We now have insight to a patient's experience on a clinical trial, a better understanding about research concepts, and we're encouraged to see some of the open clinical trials for NET patients. Thank you also, Dr. Del Riviero, for that beautiful tribute to our dear friend Giovanna. Giovanna showed me those pictures as she shared with me what a fabulous time she had at that cooking class in Barcelona. Moments like those are why we go through all the treatments and research so that we can enjoy life. So as I said earlier in the program, we have launched a Vision Initiative. It coincides with NET Cancer Day, Giovanna's birthday, and the anniversary of her passing. So we invite you to join us in carrying on Giovanna's vision. We're now going to shift from talking about disease and treatments to talking about thriving. I'm excited to introduce NET patient Cindy, who has an inspiring story of how she doesn't let metastatic grade 3 NET prevent her from living a rich and active life. Following Cindy's story, hospice and palliative medicine physician Dr. Chandana Banerjee from City of Hope will give a presentation on living with cancer during COVID-19. Let's welcome NET patient Cindy and Dr. Banerjee.
Hi everyone, I'm Cindy Poole and please forgive my appearance. I am fishing with my family today up in the Sierras. It's a beautiful fall day and I thought this would be the perfect backdrop for me to talk to you. Lisa Yin wanted me to let you know how I've dealt with COVID and being cooped up all the time. But my dealing with COVID really is how I deal with neuroendocrine cancer. I began walking, which led to hiking the day of my surgery. Just like many of you, I had to have a resection, and the minute I could, they had me up and walking. And I vowed to myself I'd walk a little bit further each time I got up. And I did. I just a little further, even if it was just 3 steps. I would remember where I ended, I would walk a little further that next round. Pretty soon I was walking about 3 times a day, and when I left the hospital I was walking 1.5 miles. I really, in my youth, enjoyed hiking, and this was a great way to increase my physical fitness, was walking, which then led later on to hiking. I didn't really start hiking until about 2 or 3 months after my surgery. I made sure it was okay with my doctors. Thank you, Dr. Mercy. Thank you, Dr. Gong. And I remember asking Dr. Mercy, my surgical oncologist, how far can I walk? She said, unlimited. Listen to your body, walk as much as you want. So 8 months after surgery, I hiked the Tour de Mont Blanc, which was 110 miles around Mont Blanc in Europe. It's Europe's highest point. I went through countries France, Italy, and Switzerland. That was a bucket list. I would never have done it if it hadn't been for the support that I have at home and my girlfriend that planned the trip. But I kept going. It's the best way. Getting outside is the best way, I think, to deal with COVID. When you're out in nature, if you can find a place that doesn't have a lot of people, you don't have to worry about COVID. It's a non-problem. The problem is we have neuroendocrine cancer, and many of us have carcinoid syndrome. What do you do when you're outside and you know what? Visits or hits, or you know what I'm talking about. Well, as it happens, the hiking community online on forums, they love to talk about how to go in the woods. And I learned that it's okay to dig a hole and do what you have to do. And there's something called a backcountry bidet, where you have a bottle of water and you put this little $2 top onto the bottle, and it's your bidet. You can clean yourself in nature perfectly well and continue on and have a great time. It became a non-issue for me, where that's like the first thing most people think about that have ulcerative colitis or Crohn's or carcinoid syndrome. How am I going to go in the woods if I have a problem? It's pretty easy. It's doable. I also have a kit that I carry always in my vehicle, as most of you do. I have an extra set of clothes just in case. And I make that simple and easy to carry. It's just leggings. I have a cleanup kit and everything, so if something really bad happens, I can take care of myself. My hiking is really an important part of who I am and how I give back to the neuroendocrine family and community. So I started an Instagram at Zebra Hiking, and you can follow along on some of my adventures there. Sometimes it's a visit to the hospital, it's getting my shot, sometimes it's going to the top of a mountain. But I try to show how I live with cancer and prepare to go to the outdoors and do these long hikes. A lot of communication with my doctor is involved, a lot of communication with my dietitian is involved. But it's doable. And during times of COVID, there's nobody out on the trail. Sometimes you don't see anybody. So COVID's a non-issue, and it gets me out of the house and it helps me clear my head. And look at this view. Look at that. The fall colors are turning. That lake is spectacular. People who come and say hello, they're probably 30 feet away and they give a wave and say hi. So that's how I deal with COVID. And that's how I deal with life. Follow me on at Zebra Hiking. I would love to share my journeys with you and have them inspire you in some way. Take care.
Hello everybody, I'm Dr. Banerjee from City of Hope. I'm the Assistant Clinical Professor in Supportive Care Medicine, and today we're going to be talking about cancer and COVID-19. So let's talk a little bit about COVID-19. COVID-19 is an illness caused by a novel coronavirus that was first identified in an outbreak in Wuhan, China in December of 2019. Coronaviruses are a large family of viruses that can cause mild illnesses such as common colds to more severe diseases such as severe acute respiratory syndrome and Middle East respiratory syndrome, better known as MERS. How does this virus spread? It can spread from person to person through small droplets from noses or mouths. Droplets are produced when a person either coughs or sneezes. A person may get exposed to COVID-19 by breathing in these droplets. They may also get exposed by touching a surface that has these infected droplets and then touching their eyes, nose, or mouth. Most commonly, the virus has been known to spread through close contact within 6 feet. The virus can also spread by airborne transmission. In an enclosed space, virus particles can remain in the air for minutes to hours and can infect people at distances of more than 6 feet. Knowing this is especially important in our patient population. There's a lot of anxiety and fear associated with acquiring COVID-19, especially when you are in a situation where your immune system is suppressed. It can be an especially difficult time for those with cancer during COVID-19 on every level, whether it is psychological, social, or emotional. There can be limited access to cancer treatments. Patients might be living in an area of surge. Access to hospitals might be limited. Bed capacities can be limited. If they have procedures that are not life-saving, that are scheduled, those may be postponed due to the pandemic. The risk of infection due to a weakened immune system is an issue for most cancer patients. Fear that cancer treatments leave patients immunocompromised. That leads to patients fearing a more severe course of COVID-19 compared to the normal population. Pandemic and fear of infections can bring back memories that can lead to anxiety, stress, anticipatory grief, and also depression. If COVID-19 is giving you anxiety, there are many things you can do to ensure your health. Here are some tips from City of Hope psychiatrist Mona Mojtazadeh. First tip is to relax. If you are in acute distress, start with relaxation techniques that work for you. These could be something like breathing and progressive muscle relaxation, but also practicing mindfulness, paying attention to your surroundings. Some people can meditate, others listen to music or take walks. Whatever gives you a break is what you should be following. Identify, write down your thoughts and emotions and actions that are prompting you to lead to anxiety. Are you exaggerating the significance of just a cold or a cough? Or is it something more serious? Take control of the emotions that you are feeling. Connect. Ask yourself, how are my current feelings of stress connected to my past traumas? Examine that relationship to help achieve a sense of control. Reach out to other people. We may be self-isolating and physically distancing, but this is no time to be alone. You need to remain socially connected to ease your anxiety and also to maintain your community of family and friends. Go easy on the news. Keep up with all the latest information, but try not to get overwhelmed. Try to help others when you can. It's also okay to ask for help. Maintain a low threshold for seeking help. The right assistance, whether it's psychological or whether it's medications, can make a big difference. The last aspect is unity. This is a pandemic that we are all facing together. And personal challenges brought on by cancer, this pandemic can also be a shared crisis. Remember that we are all in this together, and we are only safe if we all are safe. So we need to help each other through this. So what can you do to support cancer patients through COVID-19? Many cancer centers, at many of them, loved ones cannot visit people in the hospital or accompany them to their appointments. At home, individuals with cancer are especially vigilant about physical distancing from visitors. These are uncertain times that bring about a lot of anxiety, fear, and depression in those that are already diagnosed with cancer. This, as we've seen, can lead to increased isolation and loneliness for cancer patients. Maintaining a support system is extremely critical during this time. Physical distancing does not have to mean social distancing. One can still maintain social interaction with cancer patients by the following guidelines. You wear a mask. Physically distance yourself. Hand washing and use other appropriate PPE equipments. Using technology to interact with loved ones is an excellent way to keep in touch. You can use email, you can use the telephone, or you can video conference your loved ones so that they do not feel alone. If you cannot visit them, then check in with them often. Ask them if there's something you can do to help them. Some patients may not be able to leave the home, so you may be able to help them with simple errands. Arrange for virtual gatherings or happy hours to decrease isolation. If there's a birthday, celebrate it via Zoom. Let them vent to you. Sometimes you just have to sit and listen. The most important thing is that make it about them. Make them feel loved. Thank you.